Alright guys, welcome back to my channel. This is my second Therapist Reacts to series. It's for the Netflix series Gypsy, which I heard wonderful things about, I guess. Interesting things. This is going to be a two-parter. So I'm going to do part one now, and then the one for next week will be part two. So it'll go through about half of the show this week, the first episode. And without further ado, let's get started.
It was a very traumatic breakup for her, but I'm nervous. I read that women over 35 are 53% more likely to end up alone. I read that in the Sunday Times. Have you heard about that?
Claire, you can't blame yourself for your daughter's breakup. Rebecca's relationship is her responsibility, her choice.
I thought of signing her up with OkCupid. Isn't that what they call it?
But it's not your decision. For all you know, Rebecca might already be on OkCupid or dating. See, if you keep trying to control her, she's going to keep pushing you away. You know what I'm going to say.
Yeah, I know. Boundaries. I know. But, I'm worried. I can't help it. She works all the time and she does not date. And soon she's going to be old, and then what's going to happen to her?
Our goal in this room is to focus on you. And for now, you just need to carve out some time and figure out what it is that you need to be happy.
Okay. So my first thing I noticed with this woman is that she's very concerned about her daughter, and yes, therapy is all about you, the individual coming in, but it's also about relationships. And what this woman is bringing to us is a lot of worry and anxiety about her daughter. And I would explore, if this was my client, I would explore more the function of the worry. Like, is she a single woman herself? Is she, feeling lonely? Is this making her unhappy, and thus she doesn't want that for her daughter, because no parent wants their child to be unhappy, and so she's worried that her daughter's going to be alone and lonely like she is. And for on her daughter's end, it might be she's perfectly content being single. Maybe she's not looking right now. It's not something the daughter's worried about. I do like that this therapist here is kind of asking her to reflect on what makes her happy, but also I think she needs to be dismissive of the woman's feelings, because they're coming from a place of caring. And that's just kind of one of the things I noticed, that maybe I would do a little bit different.
Jean, can I ask you something? Friend to friend.
I'm not your friend. I'm your therapist, Claire.
Well, just about this, I mean, you are. I just want you to know that I really like to please you. But I have a hard time letting go. I cannot let go.
It's a process.
All right, I'm just gonna be upfront. I don't even like what she did there. I'm sorry. Soft therapy is incredibly powerful, incredibly intimate, and it's common for our clients to become very attached to us. They're sharing things about themselves that maybe other people, they've never shared with anybody else before. So they're being very vulnerable. We're listening, helping them kind of figure out what they want and supporting them as they go after that. So it can be very powerful, very intimate. Over time in therapy, they'll start to feel kind of bonded or close with the therapist. And just like this woman said, like, I feel like you're my friend. And so the first time she kind of shut it down, I was like, well, no, I'm not your friend. Now, based on what she said earlier in terms of talking about the unconscious, my take is that she's probably a little bit more psychoanalytical. And so her take is going to be like a little bit more hands off than somebody like me who's more attachment based, where I focus on the relationship. So I'm going to be talking to this person and being like, validating her feelings that yes, it feels really close, and also holding the boundary that this is not a friendship relationship. This is a therapeutic relationship. And yes, it's very powerful and intimate, and you have all these feelings, but it's up to me as a therapist to make sure that boundary is upheld. It's for the client's protection, right? it's up to us to kind of hold it. And there's a way we can do it gently so that the person doesn't feel like we don't care about them or we don't hear them. Because I know for myself and all my colleagues that I'm in contact with, we deeply care about our clients. Like so to pretend like that doesn't exist is a fallacy. And I know with Freud's theory and psychoanalysis, it's more like the blank slate. You lay on the couch, you kind of talk about things, and the therapist doesn't really insert anything. But for other modalities like CBT, cognitive behavioral therapy, where you're focusing on the thoughts, the feelings, and the behaviors, or attachment theory, where you're talking about relationships, or somatic work, where you're kind of bringing in the body and connecting the mind and the body together. These types of intervention, like these modalities, are more relationship. The client's talking about like, I really want to please you, and no, you're not here to please me. Like, you're as my client, please don't ever try to please me. Like, in fact, you should be challenging me. This is part of the work. This is part of the relationship, right? If I say something that you're not really comfortable with, then I want you to speak up, right? Especially if we're working on boundaries, because part of the issues with boundaries is an inability to kind of state what you need and go after it, right? And I would want to practice that in session. So I don't want my clients coming and trying to please me, because that's not healing for them. Um, that's placating, and it just does them a disservice. So I feel like she should have just addressed it better.
Hey, Sam, come on in.
It's not just that. I don't know, I keep hearing her voice in my head. I wish it would stop, but
Sam, it's okay to be emotional.
it's been 8 months. You must think I'm such a loser.
I don't judge. And who cares what I think anyway?
She made things exciting. Whatever you were doing, she made you feel like you're part of the best thing in the world. It could be buying groceries. It didn't matter. I never was adventurous, but she made me feel like I was. And now it's like this thing was taken from me, and I feel worthless.
No, it's okay. You just need to give it some time. You guys were in a very serious codependent relationship. And it makes sense now that you feel like you can't survive without her. Maybe it'll help if you go home, pack up her stuff, and just put it in a box.
Okay, so one of the things I liked that she did was the intervention about packing up her stuff and putting it in a box, especially because he's codependent and codependency is real. This kind of feeling of not knowing who you are unless you're in a relationship with somebody else. So often codependents have low self-esteem. They measure their self-worth based on what others think about them and say about them. So oftentimes they get into these intense romantic relationships where the person makes them feel like they're the center of the world, and they feel good and it's electric, and they just don't know themselves outside of that. So it sounds like he's still grieving the ending of that relationship, and so she's not trying to just minimize his feelings or snap him out of it or anything like that. So having him kind of put her stuff in a box, um, as like a part of beginning to slowly close the relationship, I think is a really nice intervention.
So he planned the proposal, but is anxious because he's still cheating with his coworker.
How long has that been going on?
About a year.
He shouldn't marry her.
That's not for us to decide.
Let me pause it here. So, therapists, we have to hold confidentiality, right? Our clients come in with this private, deep information, and we don't share it with anybody. The benefit of that obviously is, you as a client have a safe space to talk about things. So being a therapist is a really, really tough job. I know that many people think it's easy and cushy, but we're literally sitting for hours every day, hearing people's stories, right? The pain that they're in, like literally sitting with somebody in their pain, and it's hard, it's intense, and so one of the many things, ways that therapists kind of improve their skill set, but also kind of talk about these things, is either by going to their own therapist and kind of talking about these things, and of course the benefit of that is, therapy is confidential, so you know you're not violating anything by saying, I had a really tough session, da 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 da. And the other one is something like this, which is called either a consultation group or a supervision group. So when we're getting our hours and before we practice or get licensed to become therapists or psychologists or social workers or licensed professional counselors, like whatever the modality is you choose, we do all this schooling, obviously. We work, and see clients under a supervisor who's experienced and has a license. And part of that process is to sit in a group like this, and talk about our clients. Um, Once licensed, it's not something that we're required to do anymore, but many people continue doing it because it's really beneficial. It's a way for you to it's a way for us rather to process what's going on in our sessions. B, it's a way to talk about anything that we're kind of getting stuck with our clients, because, you know, sometimes our clients get stuck in the process, and we, being close to it, we can't really see our way out of it either. So it's a nice way of getting some feedback, and being able to kind of talk about what's going on in session. And again, these groups, supervision therapy, we don't walk in and say, my client, Samantha Brown, age 55, lives in, Berkeley, California. And that, like, we don't do any of that, but we kind of summarize, like, I have a client, she's 35, she's concerned about da 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 da. So it's pretty general, but it's enough information so that other people who are there to help us can kind of, they have enough information to give us, a little bit more perspective or a different way of going. So that's what's happening here. This is, they might be in a group practice, or they might be in their own practices, and they're just meeting together. And usually these groups meet like once a month, or some are every week. It just depends on the group. So that's what you're seeing right here, and it's really common.
Here to address his issues, not make his decisions.
Sorry, I just feel like we've been hearing about his rampant cheating stories for the past year straight. And now he's getting married.
Well, behavior change takes a long time. And he's made growth in his commitment to his relationships, so as long as he's showing up for sessions and putting the work in.
I'm not questioning that we support our patients, but if they keep making poor choices, we need to change tactics. It's just disheartening that sometimes all we can do is help them keep their head above water.
Jane, I understand it can be frustrating. We have to trust that with time comes clarity. And at the end of the night, we go home to our lives and they lead theirs.
Okay, sorry. Another point of interest. I find it really interesting that I felt like she was being very cold in her session, and then here she's having this consultation with another therapist, and my take on him is he's incredibly cold and just very dismissive. To be like, look, at the end of the day, they go live their life. Not that. How is that helpful? Like, that's not helpful. If I come in and I say, I'm really stuck with my client, this is something we're working on, I don't want somebody to sit there and be like, well, they go home and live their life and that's the end of it. Like, that's just so dismissive and it's not helpful. I don't know. A lot of times these consultation groups, the reason they're so beneficial for us is because we can just talk about how hard it is. And a lot of time it's just enough to have somebody listen to us. And so I don't know. I just feel like he wasn't listening. I don't like it. And interactions like that can definitely impact you as a therapist. So if you have somebody who comes at you like that when you're trying to process what's going on in your sessions, maybe finding a different group or addressing it to them, outside of it, or just basically not letting that their take get to you, because you're coming from different worldviews is really helpful.